what I want you to understand most clearly is that when you have kidney disease, it is doubly painful. First, it results in physical discomfort because going on dialysis is a shock to your body's systems, and you can expect to experience considerable physical pain and discomfort. But the greater pain is in the way it disrupts your life and changes it completely. Life with kidney disease is not easy. You don't get cured. It doesn't change until you get a transplant. And even then, even though you feel and function better, there are still lots of things you can't do. Fortunately, however, people do manage to survive and thrive with kidney disease if they have a lot of educational and personal support. So the National Kidney Foundation of Michigan has developed what is called the Peer Mentor Program. It's effective, it's simple, and it's amazingly inexpensive. Let me show you how this revolutionary new volunteer program works. When you first learn you have kidney disease and you're stuck there with the dialysis machine cleaning your blood for you, there's really only one source of information that you intuitively trust and are really ready to listen to, and that's the person in the dialysis chair next to you who has been through it. They know what's happening, and they know what's going to happen to you, too. Peer mentors, then, are volunteers who have kidney disease, but who have learned to take good care of their health with kidney disease and to live life beyond it. They listen to and coach new patients about their situation. They become role models for how to live life around their disease. They focus attention on how to make the right decisions every day. They help patients shift their attitudes and fears so that they can regain courage and strength to take back control of their lives. And here's the thing that's so rewarding. The peer mentor approach is working. We're getting excellent results, measured over at least 2 decades of doing this. People who have been mentored by a peer follow directions better, they communicate better with the renal team, they make better choices, and they get back in charge of their lives. The numbers, the metrics are there to show the progress we can make with the Peer Mentor program. And here's the clincher. For every kidney disease patient who goes through the peer mentoring process, they can save about $100,000 in healthcare costs over the rest of their lives. That's a big saving. Starting this year, the goal for the Peer Mentor program is to put at least one peer mentor in each of the 200 dialysis units in the state of Michigan. That's going to be a substantial undertaking. It's going to take about 5 years to do this, and the cost is going to be about $100,000 or more per year to set up the program statewide and keep it going. Peer mentors are the key to better quality of life. But how do we know the Peer Mentor program saves so much in healthcare costs? Let's take a look at just a few more numbers. The cost of treating diabetes in the United States each year is more than $150 billion. In Michigan, that cost to treat diabetes is $6.5 billion. The cost of treating people with kidney failure in the United States each year is more than $15.64 billion. In Michigan, the cost to treat kidney failure is $582 million. So, when we achieve our goal, some 500 peer mentors throughout the state of Michigan will reach about 5,000 kidney patients a year, and the results of their work with those patients will be a savings of about $500 million in health care costs to those patients. In 10 years of running a fully statewide program, we expect to be able to save the people of the state of Michigan over $5 billion in medical care expenses and return more than 50,000 people to better, more healthful, more productive lives, even though they have chronic kidney disease. How do we know this can work? Well, take a look at the costs. Dialysis costs about $61,200 per year per patient. If a patient stays on dialysis for 10 years, that's a cost of about $612,000. But if that patient gets a transplant, the transplant costs about $90,000 with an additional annual expense of close to $8,000. So the transplanted patient's expenses for a 10-year period might total about $170,000 as opposed to $612,000 for the non-transplanted patient. That's a 10-year savings of close to $500,000. The single most effective way we've found to move a patient on dialysis over to transplant status is through the peer mentoring program. Why? Because, as I've said before, peer mentors help patients shift attitudes and fears so they can regain the courage and the strength to take back control of their lives. They focus attention on how to make the right decisions every day. That prepares dialysis patients for being good transplant risks, and it helps the patients deal with all the issues attendant to the transplant process and living within the regimen required for transplant recipients. So peer mentors are the key to better quality of life and to cutting a huge chunk off the cost of medical care for our communities. If we're going to make life worth living for those who get chronic kidney disease, we must train more peer mentors. That's why we hold the Brighton Kidney Walk each year. It's the primary means of support for the Peer Mentor program, and that's why your support for the Brighton Kidney Walk and your financial contribution are so important. Every dollar you give, every hour you volunteer makes a real, visible, measurable difference in people's lives. Yes, it's about saving lives that otherwise would be lost. And yes, it's about saving significant dollars in health care costs, too. So now you know why your support of the Brighton Kidney Walk and your financial contribution are so important. Now let me show you a little bit more about the Brighton Kidney Walk itself and let you see what a fantastic community-spirited event this really is. The Brighton Kidney Walk is the place to see and be seen. Walkers come from the community and from miles around southeast Michigan. They come to support the Peer Mentor program of the National Kidney Foundation of Michigan, and that's where your support of the Brighton Kidney Walk comes in. The Brighton Kidney Walk is designed to bring many interested, concerned people together in one place to support patients who have this disease, to help people understand more about kidney disease, and to help them learn how to prevent it. There are several ways you can help get this job done. First, your financial contribution defeats fear and depression, replacing them with hope and determination to fight the disease and win. Second, we want you to walk with us. Last year we had over 200 walkers in Brighton. This year we'd like to double that number. The more people we have, the stronger our message will be. One of the fun things about joining the walk is getting your friends and family involved. We'll coach you through this process and show you how easy and fun it is to set up a website of your own to invite people to sponsor you. It's fun and exciting to see the pledges mount up as you promote the Brighton Kidney Walk to everyone you know. Third, even if you can't walk with us in Brighton, you can participate in helping to raise money for the Peer Mentor program that the Brighton Kidney Walk supports. There are plenty of possibilities. For instance, you might get involved in selling tulip bulbs, or flowers, or pin-ups advertising the walk. You might collect bottles, or cans, or grocery store receipts. Just remember, every $1,000 raised provides training for another peer mentor, and that peer mentor, working with a patient, can save more than $100,000 in that patient's lifetime health care costs. Your gift, big or small, helps the Peer Mentor program succeed. But most important of all, your support demonstrates your community spirit. Your community spirit saves and transforms the lives of those who suffer this terrible disease and lowers the cost of their health care dramatically. That's good for all of us. Thank you for your support.